The American Dental Association estimates that 175 million patients in the United States each year have cavities that are filled in a dentist office. So that means that everyone in the sound of my voice, including you and me, at one point have had or will have a cavity that will be filled in a dental office. How does that happen? What is the dentist actually doing when you're cringing in the chair and he's in your mouth with a high-speed drill? Well, that's what I want to talk to you all about today. It entails the diagnosis of a cavity, the actual preparation of the tooth, the filling of that tooth, and post-operative procedures after the filling to ensure that filling is going to stay healthy. So first, we're going to diagnose the tooth. Usually, caries or cavities are identified in prophylaxis treatments or cleanings with a dental hygienist. The dentist must make the final call and diagnose the cavity because some small indentations, we can just put watch spots on. They don't actually need to be filled. And very deep cavities may necessitate root canals or actually a crown. The dentist may take an x-ray to see how profound that cavity is if he can't see from the outside in how deep that cavity goes. Once the cavity is diagnosed by a dentist, everybody's favorite part, the dentist will put that wonderful aspirating needle into the encías or the gums and the gingiva there, and the gums will become to feel numb, and the dentist will be able to proceed with removing all the decayed tissue with a high-speed drill. He may use a caries indicator or a green liquid that is placed onto the tooth to show any little hard-to-see bits of decay. Once all the decayed tissue is removed, the dentist will use a small amount of phosphoric acid called etch to create micro corrugations in the tooth to allow somewhere for the composite to stick to. The dentist will put a little bit of bond on there and cure it with a light, and the tooth is prepared to be filled. So after that tooth has been prepared, we're actually going to start filling the tooth. The dentist will match the tooth to a specific shade of composite, and the dentist will shape that composite once it's actually in the tooth to make sure that you'll have the correct dental anatomy and be able to chew with that tooth after the procedure. The dentist will cure the tooth with a very bright light, which ends the filling section. All of that composite has become hard as your teeth. So we'll move on to post-operative procedures. The dentist will have you bite on a blue piece of articulating paper to make sure that you're not hitting that filling first before any other parts of your teeth. Because if you bite too hard, too much on that new filling, it might pop out or it might cause a lot of pain. So the dentist will have you bite on that articulating paper, and he'll use his high-speed drill to smooth out any edges and remove any excess composite there that has been hardened with that very bright light that they used. After which, the dentist will polish the teeth to make sure that there's no gritty pieces of that composite that have stuck to other neighboring teeth unexpectedly. And then we'll get that wonderful talk about the importance of flossing, brushing, and any necessary changes that the dentist advises the patient to make to their oral healthcare routine so that they don't have to come in for cavities in that same spot again. So to recap, each cavity requires a diagnosis before it is filled. Each cavity then will require the tooth to be prepared with that anesthetic and carving out the decayed tissue in the etch and bond. And then the tooth will need to be actually filled with a composite that matches the shade of your teeth and shaped correctly with a burnisher and cured with a bright light, after which there's post-operative procedures, including checking the occlusion with that articulating paper and polishing the tooth to make sure that there are no rough patches or spots. And of course, necessary changes that the dentist will advise the patient to make to ensure that those cavities do not progress or return to that area of the mouth. All of these steps may seem lengthy and might feel like forever when you're in the dental chair, but it is necessary, and each of these steps contribute to the overall success and viability of that filling.